An investigation has found South African medical aid companies guilty of racial discrimination. Cases involving black doctors were more likely to be identified as fraudulent, wasteful or abusive. GEMS fared worst in identifying black providers as committing fraud. For more on this conversation, we're joined by Dr. Kgosi Letlape, former president of the Health Professions Council of South Africa. Morena, thank you very much for joining us this afternoon. So the report knows that this is degrading, humiliating and distressing. Any surprises on the findings on your part?
Good afternoon to you and the listeners. Absolutely no surprise from my part, because the medical aid enterprise in this country has turned out to be parliament-enabled gangsterism.
From the work...
So the issue of racism is embedded in the evolutionary structure of medical aids as we have them today.
From the work that you did at your time, where in your position, what is it that you saw that can corroborate what it is that this report is saying?
What we have seen, we've seen cases reported to us by medical aids. And as soon as doctors resisted and stood up to the medical aids, the cases would disappear. Those that fell to this blackmail would then be subjected to financial prejudice. And what is amazing is that they have fraud units that are acting unlawfully. How can you be labeled a fraudster when you have not been reported to the police and it is something that has not been pronounced by the courts of this country? How do you make a deal with someone that you've labeled as a fraudster to pay you back on condition, and then you can continue to pay them back? What has generated this type of scenario is the fact that historically, medical aids used to guarantee care to members and guarantee payment to providers, provided they charged within the rates that the schemes approved through negotiation with the profession. It was a statutory tariff that was the same across schemes. But members were guaranteed care and providers were guaranteed payment if they met the terms and conditions and provided services. Now, once the rules changed, when medical aids pay you as a provider, they are doing you a favor. They can even elect in some instances not to pay you and to refund the patient who has already received services from you. Nothing could be more shameful than what they've put us through. And they are destroying the fiber of the profession, particularly the black professionals. The difference in our practices is that we serve people that the medical aid contributions is a sizable portion of their salaries. They don't have money to pay us upfront and claim from medical aids. But white doctors largely want their patients to pay them up front, and the patients can sort themselves out with their medical aids. For most black doctors serving the black population, that is not possible. And that is what makes us vulnerable. So we provide services, will never be paid, sometimes for no reason. They just don't pay you. And you got no recourse because there's no contract between you and medical aids. You've seen medical aids take patients away from black doctors that they have been serving for years. They create preferred provider networks with conditions that take away the responsibility of doctors to put patients first, that violate the patient's right to choose a healthcare practitioner of their choice. This is across the sector. It does not just affect doctors. As you saw from the report, social workers are the most impacted. Physiotherapists are impacted. Dietitians are impacted. They are doing it across the board for healthcare professionals.
That this has been going on for so long tells us what? I mean, does this mean that they have free reign and people can do as they like? Is there no regulator?
There is really no regulator. Once the last Minister of Health in the era of apartheid, Rina Venter, changed the rules from no guarantee of care for members and no guarantee of payment to providers, all hell broke loose. And Parliament is negligent in not sorting this out. So this is extortion that is enabled by an act of Parliament. And the parliamentarians are indifferent because they have Parliament and they probably have better conditions for them as members of Parliament. This is something that divides the nation. This is a scourge on our integrity as South African. This is a piece of apartheid legislation that belongs in a rubbish bin. We need to ensure that the National Health Insurance replaces the Medical Schemes Act, and care to members should be guaranteed, and call to providers that meet the conditions set out on an open basis by the fund should be guaranteed payment.
Thank you very much, Morena, for your time and your reflection this afternoon. Dr. Kgosi Letlape, former president of the Health Professions Council of South Africa.